Hello, and thank you so much for giving us this wonderful opportunity to present our work. In this video, I will be discussing our research on identifying the key predictors of chronic liver disease and how these findings can help inform strategies for promoting healthy aging. So, I will briefly cover the background and methodology and then focus primarily on the key findings and their clinical implications. So, chronic liver disease represents a significant and growing global health burden affecting approximately 1.5 billion individuals worldwide. More importantly, there has been a clear epidemiological shift from predominantly infectious causes towards metabolic dysfunction associated steatotic liver disease, which is now the leading contributor, particularly in young and middle aged population. So, this transition is very critical as it highlights the increasing role of modifiable risk factors in disease development. So, in the MENA region and in the UAE, this pattern is even more clear. Metabolic risk factors like obesity and diabetes are now the main contributors to chronic liver disease. So, identifying people at higher risk becomes very, very important to us. The objective of the study was to identify independent predictors of chronic liver disease among adults. We specifically evaluated demographic, metabolic, and behavioral factors, including age, gender, BMI, and alcohol use to better inform targeted screening and preventive strategies. So this was a case-control study conducted in a tertiary care setting with a case-to-control ratio of 1:2. We analyzed key variables including age, gender, BMI, and alcohol consumption. Statistical analysis was performed in 2 stages. Initially using chi-square testing to assess association, followed by multivariable logistic regression to identify the independent predictors after adjustment for confounding variables. So looking at the initial results, there was a significant age pattern. So individuals between 40 and 60 years were more commonly seen among cases with a p-value of 0.039. Gender showed a strong difference, with males accounting for 78.5% of cases compared to 51.3% of control, which was highly significant. Abnormal BMI was also more frequent among cases, so 84.6% compared to 73.3% in controls, again showing a significant association. Alcohol use showed the most striking difference, with current alcohol use was 14.1% in cases compared to only 0.3% in controls, and former alcohol was 10.1% versus 2%. This was highly significant with a p-value less than 0.001. Marital status and nationality, however, did not show any significant association. So this is the graphical representations of the table we saw before and the results. So after adjustment for confounding factors, 3 variables remain independently significant. The male gender was associated with an odds ratio of 3.03, indicating approximately 3 times higher odds ratio of chronic liver disease. The abnormal BMI had an adjusted odds ratio of 2.33, showing more than double the risk. Alcohol consumption showed the strongest association. So former alcohol use had an odds ratio of 5.62, while current alcohol use had an odds ratio of 53.35. This represents a very strong association between alcohol use and chronic liver disease. Although the confidence interval for current alcohol use is wide, the strength and direction of association remains clear. So, interpreting these findings, several points stand out. First, the independent association with male gender is consistent with the existing literature. This may be explained by a combination of biological and behavioral factors. So, from a biological perspective, estrogen is thought to have a protective effect on the liver, while from a behavioral standpoint, males tend to have higher exposure to risk factors such as alcohol consumption and unhealthy lifestyle patterns. An important finding is that age did not remain significant after adjustment. So, this states that age itself may not be a direct driver of disease, but rather reflects the accumulation of metabolic and lifestyle-related risk factors over time. Second, the association with abnormal BMI highlights the growing role of metabolic disease in the development of chronic liver disease. So this aligns with the current shift towards metabolic dysfunction-associated steatotic liver disease, particularly in regions like the UAE, where obesity and diabetes are very highly prevalent. It suggests that chronic liver disease in this population is increasingly part of a broader metabolic syndrome rather than an isolated condition. Alcohol consumption emerged as the strongest predictor in the study. The very high odds observed among current users indicate a strong relationship between ongoing alcohol exposure and the liver disease risk. The increased risk seen in former users may be explained by reverse causation, often referred to as the sick quitter effect, where individuals stop alcohol consumption after developing symptoms of liver disease. This highlights both current and past alcohol use are clinically relevant while assessing risk. The marital status and nationality were not found to be significant in the study, suggesting that social and demographic factors alone may have a limited role compared to metabolic and behavioral determinants. So, in conclusion, this study identifies three independent predictors of chronic liver disease: male gender, abnormal BMI, and alcohol consumption. Among these, alcohol represents the strongest determinant, followed by metabolic factors. These findings emphasize that chronic liver disease in this population is largely driven by modifiable risk factors. So, these findings support the need for targeted screening of high risk individuals, integration of metabolic risk factor into routine clinical practice, and focused lifestyle interventions, particularly addressing obesity and alcohol use. Further longitudinal studies are also recommended to strengthen these findings. So, from a healthy aging point of view, what this really tells us is that prevention matters a lot more than we usually think. So, if we can pick up these risk factors early and actually work on them, we can reduce a lot of long term disease burden. So, things like keeping a healthy BMI through simple lifestyle habits like diet and regular activity can make a big difference over time. And avoiding or minimizing alcohol is equally important because its effects really add up in the long run. So, overall, small changes made early can really translate into healthier aging and better outcomes later on. Now, these are the references. Thank you so much for your attention, and it was a great pleasure sharing this work with you. Thank you.